On this Saturday night, record cases in the hardest hit provinces. Why isn't there more enforcement to stop the surge?
Most people actually don't want to live in a police state.
And the burden on hospitals trying to help COVID-19 patients. A Global News exclusive. What went on inside an Ontario care home where the virus killed 17 people?
And people is not taking it seriously.
Ethiopia on the verge of civil war and accusations of ethnic targeting. Plus, the presidential pet and its importance to the White House.
Global National with Robin Gill.
Good evening and thank you for joining us. There has been an alarming surge of COVID-19 cases across Canada, and today is no exception. Alberta recorded more than 1,000 new cases, a single-day record. Saskatchewan just shattered its single-day record with 308 new cases. Ontario also broke a record. It logged more than 1,500 new cases. And Quebec reported more than 1,400 new infections, another record-breaking single-day increase. As we hear about these records broken on a near daily basis, there are calls for authorities to do more to stop the spread of COVID-19. Provincial governments are hesitant to use lockdown measures this time around. So what's the answer? As Mike Drolet reports, there's a fine line between pleading and policing.
Sir, I understand you're here for peaceful protests?
Second World War, same propaganda.
There doesn't appear to be a middle ground here. The protesters arguing for freedom are steadfast in their beliefs.
It's about, a government that's controlling the people with a little bit of oppression and a little bit of tyranny.
And then there's the anti-maskers like Brad Bradford, who's trying to protect family members who are considered high risk of getting COVID-19.
Wearing a mask is a minor inconvenience for any of us. I mean, it's like putting a hat on.
And caught in the middle of it all is an overwhelmed healthcare system and those tasked with enforcing the law. The problem is that the rules vary so much across the country, nobody is entirely sure what's enforceable. And that's as true in Toronto.
We have never, nor will we ever, take enforcement action related to recommendations.
As it is in Calgary.
This is not the time that we should have to enforce anything.
What he means is that after 8 months living in a pandemic and with new case numbers surging to record highs, Canadians should know better. Except we saw on Halloween that isn't always the case. And with the Southeast Asian festival Diwali happening this weekend, authorities are once again opting for education over enforcement.
I know people want to come together to celebrate their faith, especially now at Diwali time, and to celebrate weddings and other milestones. But I'm asking you as the mayor, as directly as I can, to stay home as much as possible right now.
Bioethicist Carrie Bowman says that's the right way to go, for now.
One of the problems with enforcement is most people actually don't want to live in a police state. And, with the pandemic, we're really extending the role of the authorities a great deal.
But if gatherings like this turn into super spreader events, he says a firmer approach may be warranted. Mike Drolet, Global News, Toronto.
There are signs the Atlantic bubble could be bursting. New cases are popping up in several provinces. There were 2 cases reported today in Newfoundland and Labrador. Both are travel related. Nova Scotia recorded 6 new cases, so did New Brunswick. For the first time in a week, Manitoba recorded under 300 new cases today, but 15 more people have died of COVID-19 in that province. It's the largest jump in fatalities reported on a single day. They include 11 residents from a long-term care home in Winnipeg. Seniors in long-term care and retirement homes make up over 80% of Canada's COVID-19 deaths. There are now more than 350 homes with active outbreaks in Canada, and it's especially frustrating for those who were on the front lines of the first wave. Tonight, in a Global News exclusive, Farah Nasser reports on what went on inside an Ontario care home that was hit hard.
COVID-19 was an unprecedented crisis, but to those who worked in the industry, the warning signs were there.
In this field, you're always short. But we work with what we had.
Maggie Gittins worked as a PSW at Markhaven Home for Seniors near Toronto for 30 years until she caught the virus in late March.
Did you give care to that first patient?
It was my assignment. I thought, my goodness, we should be wearing everything. And she should be maybe in hospital. I had on this stuff, but you're wearing this.
Was it this kind of a mask or was it an N95? It was this kind of a mask?
This, yes.
It wasn't a medical grade mask?
This. As a result of that, I almost lost my life.
When the first Markhaven resident tested positive on March 20th, Markhaven Executive Director Mike Bakewell sent an email to the family members of residents, reassuring them Markhaven was working closely with health authorities and following correct protocols. But internal email exchanges show a lack of cooperation between the home and health authorities and failing protocols.
1 minute you're told you're not supposed to do this, 1 minute you're told you do this, so you don't know which way you're going.
In a little more than 2 months, 17 of Markhaven's 96 residents were dead. Markhaven is one of many long-term care homes named in class action lawsuits. We requested an on-camera interview with Markhaven, but the executive director declined on the advice of lawyers. He claimed they strictly followed public health guidelines and praised the efforts of staff during the outbreak.
Hi, Grandma.
Maggie Gittins spent weeks in hospital in intensive care, unconscious.
Hi, Mom.
6 months later, she's still traumatized.
It's scary for me, to go outside, to go anywhere, to go in the store, to go somewhere where you have people. It's the hardest thing to do now, especially with the second wave. And people is not taking it seriously.
Farah Nasser, Global News, Toronto.
And you can check out the extended version of that story tonight on The New Reality with Donna Friesen, starting at 7 p.m. right here on Global. As you heard earlier, 1,000 new cases in Alberta and restrictions are in place, but not everyone feels the new rules go far enough. Calgary's mayor is calling for tougher measures. Naheed Nenshi is voicing those concerns on the West Block with Mercedes Stephenson. Mercedes.
Robin, Calgary's Mayor Naheed Nenshi says people need to shake off their COVID fatigue and realize that things will get out of control very quickly unless drastic action is taken.
I feel a bit like Chicken Little for the last several weeks saying things are really bad. We're getting close to overwhelming our healthcare system. And people go, but we're only at 62% utilization of ICU beds. We got tons of room. Not realizing that exponential growth means that to go from 50% to 100% is just one step. You can do that in a week, given that we're doubling every week here now. So I'm glad that people are finally seeing how important this is.
Mayor Nenshi says many Albertans feel the restrictions announced this week were, quote, a bit random, pointing out that casinos remained open, but kids' sports were shut down.
There's a huge backlash this week after the Premier made his announcement from parents saying, why in the world are you stopping my kids' sports, which is helping them keep them sane, helping them have a bit of normalcy in their lives, where there's very little evidence of spread in kids' sports. Now, we don't actually know if that's true because 2/3 of cases, we don't know where they came from. But if the Premier had said, listen, we need to keep the schools open and we're seeing spread in schools, so that what we need to do is restrict our kids' activities outside of school so we can get the virus out of the schools and keep the schools open, I think people would have gone, okay, that makes sense.
Nenshi says identifying where the community spread is happening and a more targeted approach to restrictions will help get the second wave under control. Robin?
Mercedes Stephenson in Ottawa. Thanks, Mercedes. For more on what Nenshi thinks about the handling of this pandemic, tune into the West Block tomorrow, right here on Global. The U.S. has broken another record for new COVID-19 cases in a 24-hour period. More than 180,000 people tested positive for the virus and more than 1,400 died. Nearly every state is seeing a spike in cases, prompting governments to bring in new restrictions. And as Jennifer Johnson explains, Americans are being warned to stay put this holiday season.
From North Dakota to Texas, California to Massachusetts, new cases of COVID-19 are sweeping across America. Governors, even Republicans, are ordering stringent new measures to get the virus under control, partially locking down their states and issuing mask mandates.
Our state is caught in the middle of a skyrocketing national COVID-19 storm.
North Dakota is not alone.
My executive order.
Idaho is deploying National Guard soldiers to help overwhelmed hospitals decontaminate and test patients. New York City, New Mexico, Oregon, and many others are clamping down on indoor activities.
I'm announcing a 2-week freeze for the entire state.
Colorado has declared the situation a level 1 emergency, its highest. California is among several states issuing travel advisories.
If I have 3 children, I have 5 grandchildren, and normally we do get together, either at Thanksgiving or Christmas, but not this year because of the COVID.
November is on track to be the worst month Americans have seen, but experts warn the surge will likely peak in January.
We're going to see by far the darkest days of this pandemic between now and next spring when vaccine becomes available.
Hospitals in at least 14 states have or are close to running out of room.
We're on what we call critical bed status. That means we have fewer than about 5 general medical beds available.
In many states, lines to get tested are stretching for blocks.
All of our appointments have been filling up to the point now that we're going to be adding another half day of testing starting next week.
Many experts are telling Americans to put a stop to small indoor parties and game nights. While few health officials are advocating for a nationwide lockdown, millions of businesses are getting hit again.
The restaurant industry as we know it is dead.
This latest surge of the virus is costing more people their lives and their livelihoods. Jennifer Johnson, Global News, Washington.
Supporters of Donald Trump have taken to the streets of Washington. Tens of thousands marched along Pennsylvania Avenue. Many were carrying flags and signs backing the outgoing president. Trump delighted his supporters by driving through the rally on his way to the Virginia Golf Club. He's still refusing to concede the election to Democrat Joe Biden. On Friday, judges in the swing states of Arizona, Michigan, and Pennsylvania all dismissed court challenges aimed at overturning the election results. The RCMP have laid more charges related to violence against Indigenous lobster fishers in Nova Scotia. 74-year-old Yvonne Thibault is facing 2 counts of assault in connection with a standoff at a lobster compound last month. About 200 non-Indigenous commercial fishers swarmed this site as tensions flared over the Mi'kmaq livelihood fishery. It was one of 2 facilities targeted that day. The RCMP say the investigation is ongoing. Thibault will appear in provincial court in February. Coming up, the calls for the world to investigate war crimes in Ethiopia. And Typhoon Vanko sets its sights on Vietnam. Global National is back in 2 minutes. In the Philippines, whole villages remain underwater 3 days after a typhoon slammed the country. At least 53 people have been killed. The Coast Guard and disaster agencies are scrambling to rescue thousands trapped by fast-flowing floodwaters. Vietnam is expected to be hit tonight with heavy rains and winds up to 150 kilometers per hour. That country is preparing an evacuation plan for 460,000 people. The UN says Ethiopia is a country on the verge of a civil war, and the ongoing conflict has forced more people to flee to nearby Sudan. Hundreds of people arrived in this small border town today. This camp is meant to house 300 refugees, but it's now home to 8,000. Authorities are ramping up assistance, but the number of new arrivals is outpacing capacity. The United Nations is preparing for up to 100,000 people to flee Ethiopia in the coming days and weeks. Earlier this month, fighting began between government troops and forces loyal to insurgent leaders in the Tigray region. Hundreds of people have been killed and more than 17,000 others have fled. Ethnic Armenians in the disputed region of Nagorno-Karabakh are packing up their homes as a bitter conflict with Azerbaijan comes to an end. They're leaving nothing behind, not even the houses. Villagers set their homes on fire so they won't be occupied by Azerbaijanis. Earlier this week, Russia brokered an agreement that ended 6 weeks of heavy fighting between Armenia and Azerbaijan. The deal will see control of several areas of Nagorno-Karabakh handed over to Azerbaijan. The entire region is legally recognized as part of Azerbaijan, but is largely populated by ethnic Armenians. Russia has deployed peacekeepers to ensure this ceasefire holds. A fire has ripped through a Romanian hospital treating people with COVID-19. At least 10 people are reported dead and 7 others critically injured. A doctor tried to save patients from the flames, but he suffered second-degree burns over 80% of his body. The fire broke out in the intensive care ward of the hospital, which is located about 350 kilometers north of the country's capital. Romania's health minister says it likely started as the result of a short circuit. The country has recorded more than 353,000 cases of COVID-19 since the start of the pandemic. Still ahead, the temporary tents pitched as a lasting protection for healthcare workers.
You're watching Global National.
As COVID-19 cases surge across the country, the safety of healthcare workers is a critical concern. Many hospitals are being stretched to their limits, and they need all hands on deck. Now, a made-in-Canada device could reduce the risk to those working on the front lines while saving lives. Sulingo reports.
Shortly after COVID-19 cases hit Edmonton, emergency room physician Mark Curiel was inserting a tube in a patient's windpipe when he realized how unprotected he was.
My mask didn't fit because I didn't shave that day. So I'm wearing my mask and I'm feeling air leaking in the sides. And the whole time I'm thinking, what am I going to be bringing home to my family?
He reached out to a friend, mechanical engineer Chris Tariff, to brainstorm a solution. They came up with this, an aerosol containment tent. It uses suction and a HEPA filter to remove any COVID-infected droplets from the air.
Really, the concept is build a portable negative pressure area over a patient's head, and we built it.
Aerosol generating procedures such as intubation, BiPAP, and ventilation can spray particles up to 10 meters away, which can stay infectious for up to 3 hours. Dr. Curiel says the pandemic has changed how they do things in hospitals.
I have not used BiPAP since COVID started. And this is a technique that would get people better faster. And instead of sending them to the ICU, we can send them to the regular medicine floor.
This tent would allow airway procedures to be done safely anywhere. It's portable.
So whether it's a hotel or whether it's a gymnasium or something, if we needed to go and create a temporary field hospital, these could be basically brought out and portable enough to use for any bed in that facility.
Dr. Curiel says his ER has been short-staffed since COVID started. Reducing exposure means fewer healthcare workers isolating and fewer disruptions to the system. Whether they have a broken leg or a heart attack, patients will feel the impact of procedure delays. Anything that can increase efficiency will help everyone.
So our goal is not only let's protect the staff, but let's protect the whole healthcare system and allow these people who are saving lives to stay at work and keep doing what they've been trained to do.
Sulingo, Global News.
Trump let the dogs out. Biden's going to bring them back. Up next, all paws on deck in the White House. Birthday wishes are pouring in for Prince Charles, who turns 72 today. The royal family took to social media, posting 2 pictures of the Queen with her son to mark the occasion. Celebrations in London are obviously suspended because of COVID-19. The prince was diagnosed with the virus in March. Now recovered, the next in line to the throne penned a birthday article for Country Life magazine, addressing the pandemic and climate change. At least one tradition isn't taking a back seat in this pandemic, the presidential pooch. Dogs have joined every U.S. leader in the White House except Donald Trump. President-elect Joe Biden has 2 German Shepherds, and when his family moves into 1600 Pennsylvania Avenue, there will be a furry first. Mike LeCouture explains.
Much has been made of the historic nature of the U.S. election, and there's a furry footnote that is giving some dog lovers a reason to bark. For the first time in 4 years, Paws will be walking the halls of the White House with the arrival of President-elect Joe Biden's German Shepherds, Champ and Major. What makes this pup particular is that he's the first dog that's a rescue, adopted 2 years ago by then former Vice President Biden from the Delaware Humane Association.
This litter of puppies had come from a dire situation, and we had all really become attached to them. So it was a really, really exciting day, obviously, because President-elect Joe Biden was there.
There was no security and very little fanfare when Biden picked up his pooch, but workers hope Major's newfound fame will reframe how people see shelter animals.
What we really hope is that other people will be inspired by Major's rags to riches story. The importance of adoption is so real. There's nothing more rewarding than adopting an animal from an animal shelter.
It's long been the practice for presidents to have pets in the White House. President Calvin Coolidge had collies, the Clintons had a cat named Socks, and William Howard Taft had a pet cow named Pauline. Historically, when a first family has a furry friend, there's a copycat effect, pun intended, with others around the world rushing to get similar breeds. And that has humane societies in Canada bracing for an even bigger influx of adoptive families.
Because of COVID-19 and the pandemic and people being home during this time, adoptions have soared. But now with knowing that the new president of the United States has an adopted dog, that's really maybe just going to boost things a little bit more.
And given the current state of American politics, maybe it is time for a rescue dog in the White House. Mike Lecouture, Global News, Ottawa.
And that is Global National for this Saturday. I'm Robin Gill. Tonight, Your Canada is the quaint and colorful Kitty Vitty Village in St. John's, Newfoundland and Labrador. The popular spot is one of the oldest fishing villages in North America. We'd love to see your part of Canada, so email your photos to viewers@globalnational.com. Thank you for watching, and I'll see you back here tomorrow. Have a great night.